But now we have the option of using medical decision making, or we can use time. Now, there are some codes that are going to be only time driven, and we're going to talk about that. But I still want you to pay attention to how to use your time. So time may be used to select a code level in office or other outpatient or inpatient services, whether or not counseling and or coordination of care dominates the service. And I just kept that from the AMA. And this is just the piece that I want you to pay attention to here is about the total time that takes place on that date of the encounter, face-to-face and non-face-to-face. So what type of activities are included in the time calculation? So I want you to think about it. When you're prepping to see the patient, if you're reviewing any tests, count your time. Obtaining and or reviewing separately obtained history, performing your exam and or evaluation, that's when you're actually seeing the patient. When you're getting the history of the patient, that's your time. Counseling and educating patient, family, and caregiver. You're ordering labs, tests, procedures, that's still time and caring for that patient. Referring and communicating with other healthcare professionals when not separately reported. So remember when we were talking about having that conversation with the radiologist, or maybe having that conversation with a consultant that you had come on and examine the patient. That time counts. Documenting clinical information in the EMR. Independently interpreting results not separately reported and communicating those results to the patient, family, caregiver. And any care coordination that's not separately reportable, all of that time is counted. And so you want to make sure that you document your total time on that data service that is related to the patient and their complaint, and then make sure you still have the documentation to support it. Now, one of the biggest mistakes that I see what's going on currently when I do audits internally, these are fun audits, these are safe audits. What I'm seeing is I'm seeing a lot of providers document time but are leveling their service based off medical decision making. If you want to use medical decision making to level your code, then I want you to not put time in your note. If you want to use time to level your code, then document time in your note. You want to use whatever is more financially advantageous, or whatever going to get you the higher level of service. So there are going to be times where the medical decision making is probably high because just as acute as the patient is, but the amount of time, because how acute the patient is, might be lower. So it's going to behoove you to level your visit based off medical decision making rather than basing it based off time.